Okay, so chapter 7, it's about the gross anatomy of the skeletal system. So in this chapter, we're going to learn the two main divisions of the skeletal system. We're going to see what are bone markings, what are the different markings that we have for bones, what are their functions, and also we're going to review again the types of cartilage that we have, and we're going to start seeing individual bones, their names, their markings, their location, and their correlation with other bones, including facial bones, cranial bones, bones of the orbit, nasal cavity, paranasal sinuses. As well, we're going to learn what is the difference in terms of a structure between the adult skull, the infant skull, and the fetal skull. And we're going to see the different types of vertebrae that we have, what are the curvatures of the vertebral column, the specific disc that we have between the vertebrae to protect the vertebrae from damaging to the structure of the bone. And then we're going to see some of these joints in the skeletal system, like the pectoral girdle, the pelvic girdle, and then we're going to see as well the differences between the male and female pelvises, along with the bones of the limbs. So as an introduction, so our human skeleton is made out of 206 bones. I kept saying 208 possibly. Well, it's 206. And then, I told you that before. So these bones are distributed among two major categories: into the axial skeleton and then into the appendicular skeleton. The bones of the axial skeleton are located in the center of our body. Include skull bones, thoracic bones, vertebral column. The bones that are located in the limbs, whether they are the upper limbs or the lower limbs, these will be the appendicular skeleton bones. So that's the major subdivision of the skeleton: the central skeleton, axial, and the skeleton of the limbs, which is appendicular. Appendicular comes from appendix, which means like something extra. Well, of course, our upper and lower limbs are not extra. Okay, so, or means additional rather than extra. So, then the function of this varies. Like the axial skeleton is mostly protective. So, for instance, the skull protects our brain, vertebral column protects our spine, our spinal cord, and then the bones of the thoracic cavity protects the heart, the lungs, vital organs. The bones of the appendicular skeleton help us to move. So they have more or less different function. And then within this skeletal system, we have cartilages that, just like as the bones, helps to support and protect structures. Our costal bones, that's the name of the ribs, they connect into the middle bone in the anterior part of our thorax, which is the sternum. But these ribs connect through hyaline cartilage, which is called costal cartilage. So this costal cartilage as well, together with the bones, the ribs, protects our internal organs in the thoracic cavity. So why do we want to study the skeletal system? So we're going to see how these bones and the cartilage protects vital organs, how it enables the movement of our limbs so that we can grab objects, for instance, and You already know this because you already seen this, how this blood, it is produced in the marrow, in this bone cavity that we have in long bones. And also, you already know that our skeletal system stores minerals. Which is the main mineral that is stored by our bones? Calcium. Mm-hmm. And then, thanks to our skeletal system, we have a specific body shape and posture. Now, what are bone markings and what is their function? So the bone markings are features in the bones. Our bones are not perfectly flat or featureless. They have specific markings that has different functions. So we have three types of markings. The depressions. So these are indentations or grooves. So they can have like a little groove there. And this allows the passage of blood vessels, nerves, or helps to connect with other bones to form joints. Examples of these depressions will be fossa and notches. We will see, whenever we start talking about individual bones, some of these examples. We can have openings, which are holes or canals within the bones, and they will be helpful for providing a passageway for nerves and blood vessels, similarly as to these depressions. But these openings do not form joints as depressions. Depressions can form joints, but not these openings. Now, the names of these openings can be foramina. So foramina is plural for foramen. We can have canals, and then we can have fissures. Sometimes some foramina can be perfectly round, sometimes they can be oval. Sometimes these holes can have jagged edges, irregular edges, so these will be the fissures. Projections. This is the third type of marking. So these are raised areas or bumps within the bones. So they allow for connection to other bones to form joints, but as well, tendons can insert there. So you can have muscular insertion. As well, you can have attachment of ligaments. So they serve as a point of attachment, or they help to form joints. So connections between bones is known as joints. Names of projections. We have processes, tubercles, and trochanters. Trochanters are large, tubercles are typically small, and you can have tuberosities as well. That's another example of a projection, which is a little bit larger than a tubercle. So here is a table showing you different markings. So here we have examples of depressions, for instance. So the first one is a facet. So what is the definition of a facet? Shallow, convex, or concave surface where two bones articulate. So this is the costal bone. This is the rib. This is the head of the rib. A little bit next to the head, just below, there is a costal facet. This costal facet helps for the rib to articulate with the transverse process of the thoracic vertebrae. So two bones, the ribs, attach to the vertebrae here, posteriorly, because that's where we have the vertebrae. So it's a smooth surface in general, no matter if it's convex or if it's concave. And that's where two bones articulate, and it's a shallow surface. Now, fossa, so this is singular, fossae is plural. So fossas are indentations in a bone into which another structure fits. So, for instance, here is the distal ending of our arm bone, which is the humerus. And this is the posterior feature. So in this posterior feature of the bone, of the humerus, we have this depression that we call olecranon fossa. In this olecranon fossa fits the bone that makes our elbow, which is the olecranon process of the ulna. So the olecranon process of the ulna fits into this fossa so that you can stop the extension of your forearm and make it parallel to your arm, so you don't hyperextend beyond what is normal. So that helps us to stop the olecranon fossa. Now we have foveas. So this, it's a shallow pit, and in this shallow pit, it is found in specific areas like the head of the femur. So the head of the femur has a central depression. It's a shallow pit. This is called fovea capitis. Capitis stands for head. That's like the Latin name for head. Capitis. Spanish will be cabeza. So, because in our proximal part of our femur, which is this, we have this head, and the head has a little pit. This is called the pit of the head, the fovea capitis. Now, another depression can be a groove or a sulcus. Sulcus, it is singular, sulci is plural. So what is a sulcus? It's a long indentation along with a narrow structure. So, for instance, this is the lower edge of our ribs. So this is called the costal groove. So this is a long indentation along with a narrow structure where it travels. Why is it called costal groove? Because it is found in the ribs, and the proper name of ribs is costa. What travels in this costal groove? A vein, an artery, and a nerve, which are called intercostal. So we have VAN going from external to internal. Vein. So you have a vein, an artery, and a nerve. Why do you think is that order? Why will be most external the vein, and then most internal the nerve, and the artery in between? Why not the other way around? Why not the nerve external or outer, and then the artery may be in the middle or inner?
So the distance they have to travel?
They have to travel the same distance. in anatomy, anything that is internal, it is more fragile. So you have to protect it. Remember, in groups of animals in the wild, when there is a predator around, where do they put like the young animals? Do they put them in the outer part of the group, or where do they put them? In the middle, for protection. Similarly, for us, it's the same with our anatomical structure. So the nerve is more internal because it's more important, more fragile. And then the vein, it is less, so this one in between. And they are located in the costal groove in the lower edge of the ribs. So if someone has fluid in the pleural cavity and they're trying to take away that fluid with the needle, they have to insert the needle above in the superior edge, not the lower edge of the ribs, because otherwise they would damage these ones. Openings, so we have canal or meatus. So remember, these ones allow the passage of blood vessels or nerves. And then a canal, it's a tunnel through a bone. And sometimes some canals are narrow, some of them they will be wider, depending what passes through there. And then you can have round canals, oval canals. So it depends on what is passing. So besides allowing the passage of blood vessels and nerves, they can also allow the passage of waves, like in the case of the sound wave that goes through this external acoustic meatus. This is the lateral view of a bone that we call temporal, that we have it in here. Okay, so here we have the temporal bone, and this opening allows the sound waves to go so that we can hit the tympanic membrane, and then we can listen. So this is what is called the external acoustic meatus. Now, this is called external because we have another meatus that is internal, but it is closer to our brain. And that's where we have a nerve going through. Now, fissures are narrow slits in a bone, so with the jagged edges, and they can be formed by a single bone or by combination of different bones. We have, for instance, fissures in the orbit. The orbit, remember, is the area that it's by our eyes. So we have in here a superior orbital fissure, which is part of the sphenoid bone, and then we have an inferior orbital fissure that is made by different bones, like the sphenoid, the palatine, etc. So we will see this in a little bit more detail later, but enough to say is that these fissures are kind of slit-like openings. And what passes through these fissures? Well, blood vessels and nerves that allow us to have healthy muscles in our orbit and provide blood supply to the tissues in our orbit. Okay. Now for projections, so we have condyles. So these, remember, these are like bumps, okay? So these condyles are extensions that has a rounded end, and these articulate with another bone. Here is the view of our jawbone that we call mandible, and this mandible has posteriorly and superiorly this projection that is called the mandibular condyle. The mandibular condyle of our jaw, of our mandible, connects to the temporal fossa, mandibular fossa, sorry, of the temple bone. So that we can open and close our jaw. Crests are ridges or projections. So in our iliac bone, which is part of the coxal bone, the pelvic bones, we have a ridge that is called the iliac crest. If someone puts their hands like this, it's putting its hands against this iliac crest. Wonder Woman. I wish. Heads. Heads are round projections from a bone epiphysis. So we have a head in the humerus. We have a head in the femur. We have heads in these bones that are called the metacarpals, that form the knuckles. So these are the heads. It's found in epiphysis, rounded projections. Tubercles and tuberosities. They are small, rounded, bony projections. Tuberosity is larger than a tubercle. Now, oftentimes the tuberosities are roughened, so they have a rough surface because a tendon inserts into there. So, examples of tuberosities, we have it here in the middle of this bone, the arm bone, which is the humerus. So, laterally in the shaft, in the diaphysis, we have a tuberosity that's called deltoid tuberosity. So our shoulder muscle, which is called the deltoid muscle, inserts into here. In our shin bone, that we call the tibia, if you touch just below the patellar tendon, that's the tibial tuberosity. That's where the patellar tendon inserts into. So that our quadriceps, our large extensor of the knee, inserts into there indirectly with this tendon. Epicondyles are small projections, usually proximal to a condyle. Actually, epicondyle means above a condyle, because remember, the prefix of words, when it's epi, means above. I was thinking the word. So epi means above. What does epidermis then means? Above the dermis, right? Epidemiology, the study above people. Epi, above, demos, people, logos, study. So, we have an example of the condyles here in the humerus. So, this part, which is called trochlea, in the humerus is a condyle. And then above this condyle, the trochlea, we have a medial epicondyle and a lateral epicondyle. So this is the medial epicondyle, and this is the lateral epicondyle. Oftentimes, this medial epicondyle is referred as the funny bone, because when you hit it, I don't know why people call it funny, but you feel a tingling, painful sensation in here. What passes between the trochlea and this epicondyle? The ulnar nerve. The ulnar nerve provides sensation to this area, the medial area of the forearm. So when you hit it, you are compressing the nerve, and that gives that awful sensation. So those are the condyles or epicondyles examples we have in other places. Now for processes, it's a prominent bony projection, and in the case of the scapula, which is like the wing blade bone, we have this process that it is called the coracoid process, beer speak process, the coracoid. And then a spine, it's a sharp process. So our scapula also has a spine that is called the scapular spine. Like if you touch that bone and then that bony projection that you feel there, that's your spine of the scapula. You feel shy about hugging someone, you can ask, oh, can I touch the spines of your scapula? I'm studying anatomy. And then they will say, well, do you want to feel my electron process? More projections. We have protuberances. So these are outgrowths of a bone. So for instance, we have this external occipital protuberance in the occipital bone. That's actually the most prominent part from the nuchal area. If you are skating or if you are in an icy surface, I mean, sometimes it's very hard, especially if it happens suddenly, to put your hands back to not hit your head. But the first thing that someone hits when it falls right into the floor without any protection and it hits the head, it will be your external occipital protuberance. And it hurts a lot when you hit it. Trochanters, the only examples are in the femur bone, the longest bone in our body, the bone in our thigh. So we have a greater trochanter here in the superior lateral portion and in the medial inferior portion of this proximal end, which is this part. So we have the lesser trochanter. So this is like the anterior view, posterior view of the femur. So this is this greater trochanter, this is the lesser trochanter. Now lines are long, narrow ridges. So for instance, we have the linea aspera, which is this long line that runs from the proximal epiphysis to the distal epiphysis in the femur. So linea aspera means rough line. Something that is rough, in Spanish you call it áspero. So that's the definition, or those were the definitions and the images of some of these markings. Do you have any questions? Okay, now I already told you about this, but let's look at it again. The two structural divisions of the skeleton. So based on position, we have two major subdivisions, axial skeleton and appendicular skeleton. Axis means center. So the axial skeleton is found in the central part of our body, includes skull bones, vertebral column, and thoracic cage. Functions, support and protection. We will see this when we start talking about the when we start talking about the articulations or the joints, but there are certain areas of the axial skeleton that you shouldn't move, right? When you are an adult, like our skull bones. There is no purpose for moving the connection between the bones in the skull. Vertebrae, yes. Why? Because we have to flex, extend, laterally rotate, or laterally flex. We have to manipulate. But this movement is limited. And then, for the appendicular skeleton, which includes the bone of the pectoral girdle, upper limb bones, pelvic girdle, and lower limb bones, our limbs, we use it to manipulate the environment and also to locomote, to move. So in this case, this is a highly movable skeleton. While the axial skeleton, yes, where it has to move, it moves, but limited movement. So function, appendicular skeleton is movement, mainly. So here is the location of then these two divisions. Central part here, darker orange color, this will be axial, and then in our upper and lower limbs will be appendicular. And this is the posterior view. So now let's look at the bones of the axial skeleton. Starting with facial bones and cranial bones. So we have 8 total cranial bones. Some are paired, some are not paired. Examples of the ones that are not paired will be sphenoid, frontal, occipital, ethmoid. And then we have 2 frontal bones, 2 parietal bones, 2 temporal bones. So out of these 8 bones, only 2 are paired, parietal and temporal. The rest are made of a single bone. And then the cranium will be subdivided into a cranial vault or roof, which is called calvaria, and the cranial base, which is like this, located around this area, a little bit internal. So that's the cranial floor. And in the adult, each of these bones connects by not movable joints that we call sutures. But only the mandible connects to the temporal bone by what we call a diarthrosis or synovial joint. So this is the only movable joint in our skull. Why do you think is that? Why we only have this movable joint in the adults and the rest is sealed? Again? So why this articulation between the mandible and the temporal bone is movable and the rest is immovable? You can talk and eat. So So these ones don't move for protection, right? We want to protect our brain. And then we want to move, we want to eat and talk. So that's why we have a freely movable joint with this. Now, facial bones, we have 14. They support entrances to the digestive and respiratory tract. And the bones that are facial bones will be mandible, this one. Vomer is internal in our nasal cavity. Maxillary bone, this one, that holds our teeth, the upper teeth. Zygomatic, the cheekbones. Nasal bones, these ones that form the bridge of our nose, our roof, the bridge of our nose. Lacrimal, which are internal in our orbit, just a little bit superior to the bridge of our nose. Palatine, stick up your tongue, feel the palate, that's the palatine bone. And it has to be a little bit posterior. And then you have the soft palate. And then inferior nasal conchae. So we have in our nasal cavity 2 bony projections that are inferior, that counts as their own or single bone. So this will be the inferior nasal conchae. And then the hyoid. The hyoid bone, it's a bone that looks like a horseshoe that is located in the anterior superior part of our neck area. And this is the only bone that is not articulated to other bones in our body. It is held by ligaments and muscles into our body, and it helps to support the tongue and aids in swallowing. So we have several muscles that help us to swallow that are connected to this bone. So here is the angle view of the cranial bones and the facial bones as well, which are part of all these bones in the cephalic area. So cranial bones, we have frontal, occipital, temporal, sphenoid, and parietal. And it's not seen in here, but internally, we have the ethmoid. Oh, well, you can see here the lateral view of the ethmoid. Facial bones, nasal bones forming the bridge of our nose. A little bit posterior to that, they will be the lacrimal bones. This is the maxilla, zygomatic, mandible, vomer, and inferior nasal concha. And then palatine here. It's a little tiny part that you can see in the orbit, but majorly is located in our oral cavity, forming together with the maxilla our hard palate. The hard palate is made out of bone, and the soft palate is made out of muscle. The soft palate is very posterior to our oral cavity, and the hard palate is anterior. So it separates the nasal cavity, which is this, from the oral cavity. So it separates the nose from the mouth so that we don't choke. And this is the individual bones. So here we have frontal, occipital in here, parietal bones, temporal, sphenoid, ethmoid. This is the palatine, maxilla, vomer, the nasal conchae, zygomatic, and then mandible here. And then here, where is the lacrimal? See it. Here, this one. Any questions? And again, the mandible connects to the temporal bone from the mandibular condyle to the temporal mandibular fossa to form that TMJ, temporal mandibular joint. the only diarthrosis in our school. Hyoid. It has this horseshoe shape located in the superior part of our neck, connecting to this cartilage, which is called the thyroid cartilage, by the thyroid hyoid membrane, which is this. And then digastric muscles, which are these, connect superiorly to these parts of the hyoid bone, which is the lesser horns. This part in here, which is posterior, are the greater horns, and the horns faces superiorly, and then this is the body. Another name for the horns will be cornua. Cuernos. So, it assists in swallowing and also modifying a little bit the tone of our voice. The higher?
Sorry?
The boomer.
Yes.
Well, we will see when we look at the individual features of this bone, but the boomer, together with one part of the ethmoid, separates the right and the left nasal cavities. So it forms what is called the bony septum of the nasal cavity. Now, for the hyoid, I mean, the fact that it is connected only by ligaments and then muscles into the body, it kind of, I guess, plays a role in forensics as well with, well, it's like the physiological functions, which is supporting swallowing and modifying our speech. But basically, when someone is murdered with slashing of their neck in this area with a knife, this tiny bone can pop out and can be found in crime scenes.
It's the ligaments of that.
Mm-hmm. Like some people can drag the body out, and maybe they don't know so much anatomy. I mean, they leave the bone there. Now, this bone is very thin. So, it can play a role in basically distinguish between when someone is strangulated versus when someone commits suicide by hanging. If someone gets strangulated, guys, typically this bone can break because the force presses so much against the bone that it can break. Some murderers, what they do is they strangulate one person and then they hang the body. When someone commits suicide, the rope typically slides over and doesn't break the bone. Slides over the body of the hyoid, so it doesn't break. So it's there for a reason. Now let's look at fossas within the cranium and their function. So in our cranial base, we have 3 depressions or fossas. So we have the anterior, middle, and posterior cranial fossas. So in the anterior cranial fossa, we have the frontal lobes of our brain fitting into there. And mainly this fossa, it is made by the frontal bones, the internal part of the frontal bones, part of the ethmoid, and the sphenoid. The superior part of the sphenoid forms this anterior cranial fossa. Now, posterior to this fossa, the anterior cranial fossa, we have the middle cranial fossa that houses the temporal lobes of our brain. And it's formed by the sphenoid and the temporal bones. Here we have a lot of openings for nerves and blood vessels, especially in the sphenoid bone. Now, the most posterior cranial fossa, of course, is the posterior cranial fossa, and it supports the occipital lobes, the cerebellum, and the brainstem. It's made by the occipital bone and parts of the temporal and sphenoid. So here's the location of these three fossas. So this is like removing the lateral bones and the superior part of our skull so that you can see that we have internally the brain. So this is the anterior cranial fossa. So here we have like part of the sphenoid, and this is the frontal bone. So here we have the frontal lobe of our brain. And here we have the middle cranial fossa, where we have one part of the sphenoid, part of this bone, which is the temporal, that holds the temporal lobe. And then in this area, we have a lot of openings for entry of arteries, exits of veins, and then exit of some nerves. And then here in this posterior cranial fossa, which is made part by the temporal bone and the occipital bone, we have the cerebellum and the occipital lobe and the brainstem. Questions? And all of this is the base, the cranial floor. While this one is the calvaria, or the vault. So now we're ready to see bone markings, skull markings. So this is the anterior view of our skull. And then also you can see, of course, the facial bones here. So this is the frontal bone, and then the middle part and anterior part, inferior part of our frontal bone, we have this part that is called the glabella. So the glabella is part of the frontal. This forehead part is called the frontal squama. And then the superior part of our orbit, it is going to be called the supraorbital margin. So that's where we have our eyebrows, the supraorbital margin. And in this part of the supraorbital margin, we can either have a foramen or a notch. So if you have a foramen, it's going to be called the supraorbital foramen. If you have a notch, which is an incomplete foramen, it will be called the supraorbital notch. And what passes through there? Well, we have the supraorbital nerve and blood vessels. So if you try to find it and you feel there like a little notch, if you compress that for a little bit, you will start feeling numbness around this area because you will be compressing that nerve. So that's the supraorbital foramen or notch. And all of this is part of the frontal bone. The squama, the glabella, the supraorbital margin, and the supraorbital foramen. Now, for the nasal bones, they don't have major features. They're just located below the glabella and medial to the orbit. Now, something that you can see here in this deep part of the orbit, it is this optic foramen or optic canal. Cranial nerve number 2, or the optic nerve, it is the optic nerve. So optic nerve passes in the optic canal of the sphenoid bone. So that's our optic canal. And then in here we have the supraorbital fissure or superior orbital fissure. That's part of the sphenoid. And then inferiorly here, we have the inferior orbital fissure that is made by different bones, including the zygomatic, the maxillary, the sphenoid. So we have several nerves passing through here and also blood vessels. Now, the optic nerve allows us to see. It forms in the photoreceptors that we have in the posterior part of our eye that is called the retina. So, if someone has damage to this optic nerve, the person won't be able to see well or maybe not see at all. Optic nerve number 2 allows us to see. Cranial nerve number 2. Now, something that you can see in here will be like the lacrimal bones. Lacrimal bones, they have a fossa, which is called the lacrimal fossa. Lacrimal fossa allows the drainage of tears into the inferior meatus of the nasal cavity. When someone cries a lot, the nose becomes flooded with tears. So the tears goes from our orbit into the nasal cavity using this lacrimal fossa. So it is found in here within the lacrimal bone. Now here we have the zygomatic bone, which is our cheekbone. This one, blows to the face, can be broken. Same for the nasal bone. And then something that you can see here below the nasal bones is the bony septum of our nasal cavity, which is made by the perpendicular plate of the ethmoid and the vomer. So the perpendicular plate of the ethmoid superiorly and the vomer, they form the bony nasal septum. We have a cartilaginous nasal septum. The bony nasal septum is posterior, the cartilaginous is anterior. That's what separates then our nasal cavity to right and left. Why do we have the cartilaginous septum anteriorly, and why the bony septum we have it posteriorly? It forms the shape of our nose, but what else is important there? We can breathe, and it's night, you wake up for getting sip of water. You don't know where you're going. The more fragile is internal, the less fragile is external. If you have bone instead of cartilage, you will end up with a lot of fractures.
Like a hockey player.
Yes.
So Professor, from that skull, can you actually tell the difference between a male and female or no?
Yes.
That looks like a male.
Yes. Yeah, facial features and density in many parts can tell whether it's a male or female skull. So then that's the nasal septum. And then here we have the maxilla. The maxilla connects the upper teeth in the alveolar processes. Similarly, our mandible has alveolar processes. So alveolar processes hold our teeth. And then laterally, you can see the temporal bone here. And then this is the mandible. The mandible has this middle part where the left and the right mandible fuses, just like, for instance, our frontal bone before it was formed. It was two bones that they fused in the middle. So this mandible, it has this middle part that is called the mandibular symphysis. Some people can have split chin. It's incomplete fusion, but it looks so sexy. And then here, this is the mandibular angle. This is easily felt in our body. And then this is the ramus, this lateral part. And then this is the body. And this foramina here is called the mental foramen. So mental nerve passes in here, in the mental foramen. So that provides innervation to our lower gingiva, anterior gingiva, and also to our lower lip. Just as this one. If you start compressing it, you start feeling numbness of your lower lip. It's not shown in here, but we have as well an infraorbital foramen that is part of the mandible. Lateral buscle markings. Well, you can see the bones, frontal, temporal, parietal, occipital, and then part of the sphenoid. So this connection between the temporal and the parietal is called a squamous suture. So sutures are immovable connections between bones in the skull. So we have major sutures. One of it will be the squamous. So this actual part of the temporal is called the squama. So a squamous suture connects temporal bone to parietal. The connection between frontal with parietal, which one is called? This one in here. How is it called? The connection between frontal and parietal. Read it for me. Coronal. Another name is frontal suture. So we have there one. We have now frontal / coronal suture. Connect frontal bone to parietal bone. And then posteriorly here, connecting the parietal bone to the occipital bone, we have this other suture. So what is the name of that suture? Lambdoid. So the name, it comes from the lambda Greek letter. So if you see it posteriorly, this connection, it looks like lambda letter. And then I'm not sure that it's labeled there, but we have the occipitomastoid suture. That one connects the occipital bone to the mastoid process of the temporal bone. So those are lateral sutures that we can see. So squamous suture, the frontal or coronal, lambdoid, and then occipitomastoid here. This part of the temporal is called the mastoid process. So this mastoid process is behind our ear canal. You can feel it, it's a strong bone just behind your ears. That's the mastoid process. And then what else can you see? The ear canal, external acoustic meatus. And you can see this part that is made by the zygomatic bone and the temporal bone. So this is what is called the zygomatic arch. So this zygomatic arch has two parts. The temporal process that runs like this of the zygomatic and the zygomatic process of the temporal, they form a bridge. Sometimes you will see something like that, like the zygomatic has a temporal process and the temporal bone has the zygomatic process. You will see it again in the forearm. So something else that you can see here is that temporomandibular joint. So here's the mandibular condyle, and this is the mandibular fossa of the temporal. And then this is called the mandibular notch. And then this part is the coronoid process. So this is what is like the most proximal part of the mandible, or superior part of the mandible. And this broad plate, this is the ramus. The ramus ends at the angle, and then it gives like this little extension that is the body. And then in the body we have the mental foramen here, and alveolar processes, and all of course these are external features. Internally we have a little gap to hold the mandibular gland. And then we have some lines to connect muscles of the floor of the mouth, and some openings as well for nerves, like the mandibular foramen, to pass the largest nerve that innervates our lower teeth, which is the inferior alveolar nerve. So that's the one that doctors, the dentist knows. Inferior alveolar nerve, or IAN. In this maxilla, something that you can see as well is the alveolar processes and the anterior nasal spine. If you touch the lower part of our nose, that's the anterior nasal spine.